Hello everyone, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist here at Healius Cancer Clinic. Let me talk to you today about sentinel node biopsy. What is it? Should it be done at the time of breast cancer surgery? Now, when a lady is diagnosed with the early stage breast cancer and it is decided that surgery is the main treatment, then there are going to be different aspects within the surgery itself. One is the treatment of the primary or the main tumor in the breast. But this alone is not sufficient because the breast cancer, the first area where the breast cancer goes to are the lymph nodes in the armpit. So, in some way, the armpit also has to be addressed. So, the second part of the surgery is to address the armpit. And the third part of the surgery would be to do any reconstruction if required. I will talk about the second part of the surgery where the lymph nodes in the armpit need to be addressed. Why is it important? Firstly, it is important for proper staging. If to know what stage the breast cancer is in, the stage will change if the cancer has spread to the lymph nodes, and so will the treatment. If it has gone to the lymph nodes, then there is a higher possibility that the lady will need chemotherapy and even sometimes radiation. Now, what we used to traditionally do for the armpit is that we used to do a procedure known as axillary dissection, where all the lymph nodes in a certain anatomical area used to be removed. But this used to lead to certain problems. Sometimes the arm used to get swollen, a condition we call as lymphedema. Some ladies used to end up with lot of shoulder pain and difficulty in lifting and moving the shoulder. These are problems associated with axillary dissection. Axillary dissection is still required if there are multiple nodes which are positive in the armpit. But what about those ladies who do not have any lymph nodes in the armpit? When I tell they do not have any lymph nodes, it means on clinical examination and on imaging, such as mammogram or say on PET scan. In these patients, doing a full axillary dissection seemed to be a overkill, and patients would very often end up with unwanted problems, especially when the lymph node is negative. So, in these cases, the concept of sentinel node biopsy emerged. What exactly is a sentinel node? As the word itself suggests, it is something like a gatekeeper. It is the first lymph node. When we tell sentinel lymph node, it is the first lymph node into which the cancer drains. So it is assumed that if this node is negative, the rest of the lymph nodes are also negative. So by just determining the sentinel node and sending it for examination, we can determine whether the rest of the axilla needs to be operated or not. And if the operation can be avoided, then the lady is saved of these sort of troubles like lymphedema or shoulder dysfunction. How is sentinel node biopsy done? There are many methods of doing sentinel node biopsy. Basically, there is a blue dye method and there is a method which involves nuclear medicine where a radioisotope is given. What basically is done is that the dye is injected around the tumor or just underneath the nipple areola, and then the axilla is opened and the dye is found. The lymph node in which this dye is found is sent for examination. Similarly, when we use a radionucleotide, the same material is injected either underneath the areola or around the tumor, and using a gamma probe, the lymph node which has drained this is identified. The best method of doing a sentinel node biopsy is a combination of both the blue dye and a radionucleotide compound. This leads to high sensitivity and specificity, leading to less chances of missing out the lymph node. So, by identifying this and sending for examination, we can decide whether the rest of the axilla needs to be operated or not. And at least in certain cases, we can avoid a full axillary dissection and the complications that follow axillary dissection. But sentinel node biopsy can't be done everywhere. It requires specialized facilities. like it requires a nuclear medicine facility, it requires frozen section facility, because the lymph node has to be sent for examination then and there, so that the surgeon can determine whether to proceed with the full axillary dissection or not. But in terms of evidence, safety, and convenience to the patient, definitely sentinel node biopsy is something which needs to be considered in most of the ladies with breast cancer if they are negative in the axilla, that is, they are N0, or there is no evidence clinically or radiologically of any axillary lymph nodes. Thank you.